Now that we have the form straight, let's take a closer look at the bench press movement and identify all the muscles that are being worked. And let's start by looking at the shoulder movements. What does the shoulder have to do in the bench press? Well, one of the motions it has to do is bring your upper arm forward, and that is called flexion of the shoulder. So what muscles are involved in flexing the shoulder?
Well, in order to pull the shoulder forward, a muscle would need to insert on the humerus and then originate from somewhere anterior or in front of the humerus so that when it contracts, it pulls the humerus forward. The first and largest muscle that fits that description is the pectoralis major. But we need to be a little more specific here because pec major is a huge muscle with a wide range of origination points, which means it has a wide range of motions it can perform. In fact, pec major is actually separated into 3 different heads. There's the clavicular head at the top, aka the upper chest, and it's named clavicular because it originates all across the clavicle or collarbone. Then there's the sternal head, also known as middle chest, which is the largest of the 3 heads and is named sternal because it originates all across the sternum, along with the cartilage of ribs 1 through 5. Then there's the costal head, also called the lower chest, and the abdominal head because it originates from both the lower ribs and from the top of the external obliques and what's called the external oblique aponeurosis. Now let's put this in the perspective of the shoulder flexion that happens with the bench press. In order to flex the upper arm forward, the muscles would have to be pulling from either directly in front of the arm or in front and above it. So both the upper and middle chest are in a position to do that, but not so much the lower chest. It would be pulling from beneath the arm. Although it's important to note that if the arm were hyperextended behind the back, then the lower chest could flex it back to a neutral position. And it will become important when we discuss the bench press variations here shortly. However, the lower chest cannot assist in flexion past that neutral position, and so is not a primary agonist in the standard bench press.
So with the standard bench press, we have the sternal and clavicular heads, or middle and upper chest so far. But there are 3 other muscles that perform flexion of the shoulder.
The first is the anterior head of the deltoid, which also originates on the clavicle and travels down to insert on the humerus. So it also pulls up on the arm, flexing the shoulder. The second is the coracobrachialis, which originates up on the coracoid process of the scapula and travels down to insert on the humerus, so also pulls up on the arm, flexing the shoulder.
Then the third, what most of you probably wouldn't have realized that the bench press works, is the biceps.
However, the bicep muscles cross the front of the elbow, so most people know that they flex the elbow when they contract, but they also cross the shoulder joint. Both heads do. The long head originates from the top of the glenoid fossa of the scapula, and the short head originates from that same coracoid process of the scapula, so when they contract, they both also flex the shoulder joint.
So now we have 4 muscles so far that are players in the standard bench press, but we've only gone over flexion of the shoulder. And there are other movements that are necessary to perform with the bench press. One of those is we have to bring our upper arm in and across our body when you press, and that is called horizontal adduction. So what muscles are responsible for horizontal adduction of the shoulder?
Well, in order to pull the arm across the front of our body like what happens with the standard press, muscle fibers would have to insert on the humerus and then originate from somewhere medial to that point, or closer to the center of the body. Once again, the first and largest muscle that fits that description is the pectoralis major. But this time, since all 3 heads of pec major are positioned medial to their insertion point on the humerus, all 3 are involved in horizontal adduction. However, you can see that the sternal head is positioned directly medial to the insertion point, so the middle chest is the most dominant with horizontal adduction and takes on more load than the upper and lower chest. Next is the anterior head of the deltoid again. As you can see, not only is it positioned above the arm and so pulls up, but it's also medial to it, so it's also responsible for pulling the arm across the body in horizontal adduction. And the same is true of the coracobrachialis. Particularly when the arm is abducted, you can see the origin on the scapula is medial to its insertion on the humerus, so when it contracts, it performs horizontal adduction as well. Then finally we have the biceps again, but this time only the short head. You'll see that the origin of the short head is much more medial than the long head is, and so again, especially when your upper arm is abducted, like it is with the bench press, it performs horizontal adduction, bringing your arm across your body.
Now, we already had all of those listed, so no new players here. However, it's important to note that these muscles now not only perform one motion, but two motions that are necessary for the bench press. Those muscles that perform both flexion and horizontal adduction, for example, will be worked more and will carry more load than muscles who only perform one movement. For example, remember the biceps.
Both heads perform flexion of the shoulder, yet only the short head also performs horizontal adduction. So the standard bench press will work the short head more than it does the long head.
So now we've gone over shoulder flexion and horizontal adduction, but there's one more movement that we do in a bench press, and that is called shoulder protraction. When you perform a press, you have to flatten your scapula against your back in order to move your shoulder to a position where it can press out in front of yourself. And that flattening of the scapula against your back to bring the shoulder girdle forward, that is called protraction. So what are the muscles that perform protraction of the shoulder?
Well, in order to protract the scapula, the muscle would have to insert somewhere on the scapula and then originate from anterior or in front of it, so that when it contracts, it pulls the scapula forward. The first and largest muscle that fits that description is the serratus anterior, which is that finger-like muscle you can see on the side of the body. It originates from the side of ribs 1 through 8, and that inserts on the underside of the scapula, so it pulls the scapula forward, protracting the shoulder. Now you can exaggerate that protraction at the top of a press to really hit the serratus anterior hard, similar to a push-up plus motion, but even if you don't, the serratus anterior still works to pull the scapula forward during any press motion. The second muscle that protracts the scapula is the pectoralis minor, which lies underneath pec major and originates from the front of ribs 3 through 5, and then inserts on the scapula, in fact right on that same coracoid process we've seen before, so it also pulls the scapula forward, protracting the shoulder.
So that gives us two new players in the standard press and wraps up shoulder motion. However, the bench press is a compound exercise, which means it involves more than just one joint. So what is the other joint at play? That's the elbow. When you press, you have to extend your elbow out. And so what are the muscles responsible for extension of the elbow?
In order to extend the elbow, a muscle would have to originate from somewhere above the elbow and then cross the back of the elbow to insert on the distal side. The muscle that many people will recognize off the bat for this movement is the triceps. Although all three heads have different origination points, they're all above the elbow, and all three heads cross the back of the elbow to insert on the olecranon of the ulna, so when they contract, they extend the elbow. And then the lesser known of the elbow extensors is a muscle called the anconeus, which originates just above the elbow on what's called the lateral epicondyle of the humerus, and then crosses the back of the elbow to insert on the ulna. So it also extends the elbow.
So now we've identified all 8 primary muscles involved in the standard bench press movement. Now, it actually gets quite a bit more complex than that if you start going into the stabilizing muscles, for example, antagonists that are also worked. However, for our purposes, we will just stick with the primary agonists. Now, let's see what happens to those muscles and the load they carry when you start changing your form and positioning. And we'll start by taking a look at the incline and decline variations of the bench press. So with an incline press, what changes? Well, now you're no longer just pressing straight out, you are pressing out and up relative to your body. So the muscles that perform that inclined motion, which is called flexion, again, of the shoulder. Remember, flexion was bringing our arm out, but in order to press up, that same movement just needs to continue further. So what the muscles that perform flexion of the shoulder are now going to be carrying more load because it's more important and we have to flex our arms forward to a greater degree with the incline variation.
So let's take a closer look at exactly how that affects the anatomy. For pectoralis major, with the standard press, the sternal head was the dominant head because it's best positioned to pull the arm straight out. However, now we really need to flex the arm up high, so it's the muscle fibers that are positioned highest up on the body that will rely on the most. And for pec major, that would be the clavicular head or upper chest. It originates from the clavicle and can therefore do the best job of pulling up on the arm. So now it becomes the dominant player. The middle chest is still doing some work depending on how high the incline angle is, but the lower chest isn't taking on any load here.
And what were the other three muscles responsible for flexion of the shoulder?
The anterior deltoid, the coracobrachialis, and the biceps. All three originate from up above the humerus and are therefore now going to be taking on more of the load with an incline press compared to a standard press. Now let's look at the shoulder protractors. With the incline press, the serratus anterior is still responsible for protracting the shoulders. However, because it has multiple origination points on the upper ribs that lie above their insertions on the scapula, it actually rotates the scapula upward while it protracts it, which is also called a posterior tilt. And in an incline press, we need to rotate our scapula upwards in order to flex our arms up as high as we do. So the serratus anterior will be worked more in an incline press and take on more load than it does with a standard press. As we've gone over, pectoralis minor also protracts the scapula. However, because its origination points are below its insertion on the top of the scapula, it actually rotates and pulls the scapula down while protracting it, which is opposite of the way we need to go. So an incline press will work pec minor less than a standard press does.
What about the elbow? Does anything change with that? Well, if you are bringing the bar down to the same degree of flexion in the elbow, then the elbow has to extend the weight back up the same degree, the same amount. So nothing actually changes for the elbow, depending on whether you're doing incline, decline, standard, doesn't matter, so long as you are bringing the bar down to the same degree of flexion. So the major changes that take place when you move from a standard to an incline press are:
you'll work the upper chest, anterior deltoid, coracobrachialis, biceps, and serratus anterior more, the triceps and anconeus the same, and the middle chest, lower chest, and pectoralis minor less.
Now, what about a decline variation? Well, now we're not pressing out and up, we're not pressing out and straight anymore, we're pressing out and down, again, relative to our body, which is what matters when we're looking at the anatomy. So now the muscles that are involved in pushing down are going to be taking a greater amount of the load.
So first, how does that affect pec major? Well, now we need muscle fibers that are positioned beneath their insertion points on the humerus so they can pull down and out, and that would be the fibers of the costal or abdominal head of pec major, aka the lower chest. All of its origination points are beneath their insertion point on the humerus, so when it contracts, it pulls down on the upper arm, making it the dominant player in decline presses, with the middle chest still somewhat involved, again depending on how steep the decline angle is, and the upper chest taking on almost none of the load.
However, decline presses also introduce a new movement that we haven't gone over yet, and that is shoulder depression, or bringing our shoulders down. So what are the muscles that are involved in shoulder depression?
Of course, the costal head of pec major, or the lower chest, which we just discussed. And then, as we've also already gone over, the fibers of pec minor are positioned beneath their insertion point on the scapula. So in addition to performing protraction and anterior tilt or downward rotation, pec minor also depresses the shoulder. And the final change that the decline press position makes has to do with flexion. Remember, with the incline press, we had to perform more flexion than we did with the standard press. So it shouldn't come as a surprise that with the decline press, we're performing less flexion than we do with the standard press. So the muscles that perform flexion will carry less load with the decline press than they do with both the incline and standard press.
So the major changes with the decline variation are:
you'll work the lower chest and pec minor more, the serratus anterior, triceps, and anconeus the same, again as long as you're going down to the same degree of flexion in the elbows, and then the middle chest, upper chest, anterior deltoid, coracobrachialis, and biceps less.
So now we know the anatomical effects and the relative degree of load on the muscles when we change the angle of the press. But what about when we change the width of our hands on the bar, both with a close grip variation and with a wide grip variation? And we'll use a flat bench here as our example, but know that regardless whether it's a flat, incline, or decline bench, the changes, the anatomical changes that come from changing your width on the bar are the same and apply regardless of what angle the bench is at.
The first and most significant effect that changing your grip width on the bar makes on the underlying musculature can be seen by taking a look at what happens with your elbows. At the top of each rep, my elbows are fully extended with both the wide and close grip variations. However, with the close grip variation, in order to bring the bar all the way down to my chest, I have to almost completely flex my elbows. They bend far past 90 degrees of flexion, and the closer together my hands are, the more elbow flexion will be required to bring the bar down, which means the elbow extensors have to work a lot harder to press that weight back up. And if the triceps and anconeus are taking on more load with a close grip, then there's less load on the pecs. On the flip side, when I use a wide grip on the bar, look at what happens to my elbows now. They don't have to bend anywhere near as far. Even with the bar all the way down to my chest, my elbows don't even reach 90 degrees of flexion. And the wider apart my hands are on the bar, the less my elbows will bend, which means that the elbow extensors don't have to work as hard to extend the elbows. And if the triceps and anconeus aren't carrying as much load in that position, where does the load go? Well, to fully answer that, we need to understand the second largest effect that changing your grip width on the bar makes, and that has to do with the balance between flexion and horizontal adduction. Remember, a standard press requires both flexion, which is bringing our upper arm forward and up, and horizontal adduction, which is bringing our upper arm in towards the center of our body. Well, look what happens when I use a close grip on the bar. All of a sudden, there's almost no horizontal adduction in the movement because my arms are already close into my body. So all the weight that would have been moved by horizontal adduction is now all on flexion. And on the flip side, with a wide grip, there is now drastically more horizontal adduction required because of how laterally displaced your arms are, and much less flexion is required in that position.
Now, there are other subtle differences between how close versus wide grip variations affect the underlying musculature. For example, it does have an effect on region-specific hypertrophy, and I will put a link in the video description to a video where I go over that in more detail. But the biggest takeaways here are that
1. A close grip will place more load on the flexors of the shoulder, while a wide grip will place more load on the horizontal adductors of the shoulder. And since we now know exactly what muscles are responsible for those movements, we can be more specific by looking at the differences between the two and say that a wide grip will work the lower chest more than a close grip, and a close grip will work the biceps more than a wide grip. Also, even though the anterior deltoid is worked with both movements, it functions more strongly as a flexor than it does as a horizontal adductor. So just know that a close grip will also work the anterior deltoid more than a wide grip will. And 2, using a close grip will place more load on the triceps and anconeus and less on the chest, while a wide grip will place more load on the chest and less on the triceps and anconeus.
And you can actually further manipulate that differential between the load on the chest versus the triceps by changing where on your chest you bring the bar down to.
If you bring the weight down really low on your chest, then your elbows don't bend as much, and you'll work the chest more and triceps less. But if you bring it down higher on your chest, your elbows will have to bend much more, and so you'll work the triceps more and the chest less in that position. Now, I hope you remember I told you earlier never to bring the weight down to your upper chest, but in this case, it's okay because your elbows remain tucked into your side and not abducted or flared out. And it's that combination of abduction with internal rotation and heavy load that we want to avoid.